Welcome back to another episode of Twist of Fate, a small business podcast. Recall that this podcast is for the aspiring entrepreneur, and I know you're out there. You're thinking about going into business for yourself for all the right reasons. You want to make money. I mean, we all have to do that. But maybe it's you want to make the world a better place. Today, I'm here to talk with friends of mine that is the motivation we all have. At the end of the day, the glass is half full. We want to inspire you to do what we're trying to do to make the world a better place. Now, on today's episode, which we want to talk a little bit about in the database informatics system that we have, data can make changes in decisions that can be life or death. In particular, in the medical field, decision intelligence, is just a concept you're going to learn about during this episode, can make the difference for our medical practitioners. So today I'm bringing on two friends. It's our first international business that is Cohesic. And both the CEO and COO are going to be sharing their own inspiring tales as to how they came and built a business that will help all of us, the little tickers in our hearts, work better. So let's talk with them. Jordan, Christine, welcome to Twist of Fate.
Thanks, Doug. It's great to be here.
Yeah,
and it's great. You should have mentioned also this is the first time we got to meet each other in person.
True. So, to the listeners there, you should know Cohesic is a very special client of ours. It was, I would say, the largest med device and core medical imaging related, because what you'll learn is Christine and I have common history, right, in the medical imaging space. But you're right. This is the first time since the pandemic that we've been able to get off of Zoom, get off of the Google Meet, and actually meet face to face. Are you I'm kind of nervous about that, right? It's crazy, right? Whoa, take it easy.
And 10 minutes after meeting in person, we're right here recording a podcast. It's pretty crazy.
That's life post-pandemic. So we all are getting used to that, right? No mask, right? But although I keep it close, keep it secret, keep it close. So you're all the way from Calgary, Canada.
Yes. Yeah, so we're founded in Calgary, Alberta, which is just kind of north of Montana. And that's where James, my co-founder, and I met and started Cohesic. So our kind of main office is there, but we are now a distributed team, as many companies had to do following the pandemic. So,
now, are you originally from Calgary?
I am originally from Calgary,
yeah.
Born and raised in Calgary. So, and did my education there. So I've always lived in Calgary, actually. So,
hometown hero?
Yeah.
No, I mean,
you never thought of yourself that way.
No. I mean, it is a city of 1.3 million people. So within my small area of the city, I think it's good reputation. But it's
Let me say this: modesty is not typical amongst entrepreneurs, but it's here. Now, Christine, though, you're not from Calgary.
No, I'm a transplant. So this is my fifth country and my 28th move. But I was born and bred in Chicago, grew up on a farm north of Chicago.
I did know that.
My family had a little small business, so yeah, and then migrated around. And
why do you keep choosing these cold places? We can find you a place right around here and it's nice and warm.
Yeah.
So let's go back in time a little bit. So you had mentioned James, great guy. You guys got together and was it through university or research, or how did you guys start to think about using data analytics to make decisions in medical care?
Yeah, it's one of these small world networks that, even though we were probably working one building apart, we had no idea who each other were. And it was through another mutual connection, actually, that we got connected. So we had taken kind of two separate paths. My background, I have a PhD in neuroscience, did bioinformatics before that. And so I came at the problems we're dealing with from a technology perspective. How can we generate better data in healthcare? How can we provide better decision support to physicians from a data science point of view? I didn't know.
You were in software programming, or?
Yeah. So in my undergrad, I did bioinformatics, so a combination of life sciences and software development, and then to pay my way through grad school, did software development on the side, as a contractor, and kept up those skills. And so after my PhD, that all applied to moving into data science and trying to apply machine learning and artificial intelligence and big data all to healthcare. So no entrepreneurship before, other than kind of running my own side business for contracting for software dev. But my family, my dad
Paying for beer money.
paying for beer money, paying for rent, the usual things. But my dad had run his own IT consulting company, and so did my brother. So it was kind of in the air. When I was doing my working as a data scientist after my PhD, I was working in the field of epilepsy, trying to figure out how we can predict patient outcomes, and go from 10 years of trying to find the right medication to maybe a few months, right? So I was working with large databases out of the UK that we had access to hundreds of thousands of patients, epilepsy patients, and it turns out just the data quality is just not what we need to be able to do machine learning and AI for some of these very important clinical problems. Mm-hmm. So that's really where I decided the right way to do it was to form a company and begin showing people how to take that approach. And I was fortunate to meet James during that journey, and he had similar ideas, and that's really where Cohesic takes off.
So, was it you guys in Calgary, a bar with like a pint that you said, let's start a business?
Yes, kind of, but it wasn't with James, oddly enough. So it was my boss at the time. He knew I was looking for new opportunities, so he introduced me to his friend who was actually working with James, and then I happened to meet James through that guy, who was actually our first CEO. So yeah, even though James was working one building away, it took kind of going outside the university to another acquaintance and back through to be able to make that connection. But once we made it just made sense. So
excellent.
Yeah.
Now, Christine, my buddy here, we share some common history with Siemens.
Yeah, tiny little company.
Tiny. Siemens is, to the uninitiated, is a world conglomerate and a variety of healthcare specialties, but in medical imaging, we work there. Now, let me ask you this, but you were a very senior researcher, so was research always an area that you were exploring or thinking about prior to Siemens or prior to your corporate career?
Yeah, I've had multiple careers. So yeah, I was an academic researcher at Washington University in St. Louis, and
great school.
It is a great place, and wonderful resources. That was the first time I started working as an academic researcher with companies, and I learned how companies work, and I got fascinated with how you could actually use those partnerships to take innovation and really get them out to the world. Mm-hmm. And actually I enjoyed that so much that after I got tenure, I just up and quit and joined Siemens and moved to London, England.
That's a big change.
Yeah, people were like, are you crazy? You had tenure. But to me, I've always been motivated by how to get the innovations directly to helping patients, and I figured I could write 1 million papers and write grants as an academic, but unless those innovations got in the hands of companies, they weren't going to help patients.
Now, was your research already in? I believe it was MRI. You were working in those areas. Was it in the academics? Was that the area you were working in?
Mm-hmm.
Okay, wow.
Yeah, and then at Siemens I migrated. I feel strongly in order to build good products, you also have to understand the business and you have to understand all the markets and everything. So I was there almost 20 years and migrated across different areas of the business so I could learn the whole picture.
Yeah, and in healthcare, medical equipment purchasing and the manufacturers, you're right, there's a big involvement between the academic universities, between the hospitals, and it's a unique thing to learn. I'd say that we both can say that we benefited
Absolutely.
from our corporate experiences there. So good people at Siemens, we still miss you guys.
Yep.
Now tell me, so you two together are now working to bring this, I have to use the word artificial intelligence, but I think in healthcare that can be a scary thing, right? The predictive part of AI can be scary, or the missing data pieces, which also brings gaps. But you guys phrased it decision intelligence. Could we talk a little about that? Like maybe what is your intent with trying to change medical decision making with data?
To really understand this, we have to kind of take a little step back and kind of look at how decision making is done in healthcare today. So a lot of, we've been improving lifespan and reducing mortality for diseases, and this has been a huge improvement over the last, 50 years in healthcare, with all of our advances in treatment and our knowledge of disease. And a lot of that has been due to evidence-based medicine, essentially, where we run randomized clinical trials, understand how a treatment is going to affect particular patients, and then we use that for guidelines. And this is done very well for us. But we're reaching a point now where patients are living longer, diseases are becoming more complex because you have the combination of diseases that's now creating new things. And we need to personalize healthcare now to the patient if we want to continue improving their outcomes and also reduce the really growing healthcare costs that we're facing, right? So when we say decision intelligence, really what we're kind of putting a stake in the ground and saying, listen, the most important thing is this the right decision for this patient? Mm-hmm. So we start there. We go, what is the decision that the doctor needs to make? And then we work backwards. Okay, what information would help them make that decision better, right? Where could we get that from? Is it in the electronic health record already? Great, we can look at how to bring that in. Or what we've been doing for the last number of years is create new tools that allow for the capture of that information so that the doctors have that decision support right at their fingertips, right?
And we even ask the patients about their own health, which turns out to be super important.
Decision criteria, right? Like that should be a decision criteria.
It's part of the data.
Yeah.
You know how your own body is feeling.
100%.
Yeah.
Yeah, something we know is, what are called patient-reported outcome measures. These are, validated tools that, you screen for depression or for your quality of life. And we know that they're predictive of patient outcomes. We know that they're very important, but they're very rarely used in practice in the clinical environment. So again, what we do is we create tools to be able to capture that information, but then bring it to the decision maker so that they have it available. And we are now beginning to be able to predict patient outcomes. This is where the artificial intelligence aspect comes in.
Yeah.
But rather than putting AI front and center saying we're going to solve every problem with AI, again, we take approach going, given the data we have, given the the decision environment that's happening, is AI the right choice, or is this more of a clinical decision rule the right choice, right? And really bring the right tools to the job.
No, it's something I admire that you bring this up, because AI, I feel, is a term that belongs in the software environment. But now when we're talking about human physiology or patient decision making by our practitioners, like, you're right, I'll never have my physician be an AI bot. Right? Like, I'm not going to, I will admit I'm traditional like that. Yeah, I want a doctor. And I think that doctors make decisions, and I think it's a really important point that you raised. So you went back and talked about so let's say this. Everything you said makes sense.
Hopefully.
No, it makes sense. But for some reason in our healthcare system, and whether I'm talking, U.S. or socialized or, privatized, there are still these challenges. Like you mentioned, there's the standard of care, there's cost, there's a variety of barriers for physicians to not be able to make the best database decision. Do you feel, is there any of those that stand out that you feel are like high on the list to resolve, or that could be resolved by, with this data intelligence?
Yes, I think probably the biggest thing to resolve is, if we want to do data-driven decision-making, we need the best data possible and the most comprehensive data possible. And that is really where, when James and I analyzed the problem, both independently and when we came together, it was going, the systems that have been designed today have been designed out of necessity to meet the needs of running hospitals and handling reimbursement and billing and patients and everything. We now know, after decades of running that, we've learned a lot. And so really what we're doing is going, okay, with all the pieces out there, how can we connect them together and consolidate this data, but also using the knowledge we have, create tools that allow high quality data to be created for every case coming through a hospital, right? So that you are not having to rely upon poor memory to try and remember what happened to that patient one time. It's all captured, it's all available, and it's all structured in a way that helps decision making. Right?
And available at the point of care. I think that's important.
Yes.
Just think about when you're in a hurry and trying to leave your house and trying to gather up all your millions of things that are scattered all over the house. Well, you're finally going to say, oh, forget it, I'm just leaving. And a lot of medicine is a lot the same way. They're like, yeah, I know if I go dig in that database over there, I can get that piece of information, but I don't have time. I've got 15 minutes with this patient.
You're right.
So I'm just going to take what I have in front of me.
You're right. Not every decision you have the luxury of time.
Yeah, and so, but we know we're, as in the healthcare field and as patients, we're all leaving a lot on the table by not figuring out how to solve that problem. So as Jordan was getting at, one of our ways to attack that is to bring things directly into the workflow and make their lives easier at the same time.
It's a big deal because I think what radical notions, you guys are thinking beyond a particular healthcare area. Like this is holistic, like in a database way, right? Just to catch everybody up to speed where Cohesic is, right? Like you're definitely a pre-Series A company?
Pre-Series A. We've done a seed round of financing, but pre-Series A at this point, yes.
Yeah. So, but yet still been operating for a long while, right? Like you've been providing for a lot of clinical centers, even in the U.S. for a little while. Like, full disclosure, like I work with them. These are great clients of me. I can't, so I know more than you, listeners. But there's some great institutions in the United States you've already gone to.
Yes, yeah, we have over the last few years been, as we bring our products and solutions to the commercial space, been looking to demonstrate the value and validate the approach we've taken within, the best health and or most comprehensive health systems that we can find. So we are fortunate to have a few of those healthcare systems in the U.S. as customers, and are now showing the ability to improve workflow efficiency and bring that data into the decision-making space. So it's been a very exciting. It's been 6 years actually since James and I started this journey, and so it's for us to see. Now we're closing deals with healthcare networks, and we're beginning to work with top people in the world, and we're able to recruit top people in the world. It's very exciting for us. So yeah.
Dream come true.
Absolutely.
Yeah. No, I admire you both for that. So then, I to my listeners out there, I know a lot of you that aspire to do business. I think that understanding a little bit of your passion, like the belief of what you're really trying to do, can help you bridge through difficult times. So was there something or passionate, or is there anything personal in this? Like why you would want to go down this road of entrepreneurism? Because I know I've talked to you both. Like it can be a grind. It's tough sometimes.
Oh, it's always smooth sailing. No, it is. There's you run into challenges, and so I would actually say unless you have something personal, some personal drive, some internal motivation, it's not really the path you want to take. There's got to be there's easier ways to make money, right? There's easier ways, but I think to make an impact, and to that's certainly part of my own personal drive is to have impact in the world. That's what gets you through those, downturns on that roller coaster and everything.
And for me, I mean, you asked me earlier about my other career transition when I went from academics to Siemens. And then this transition from Siemens to Cohesic just over 3 years ago was another one where I just felt like, okay, multinational, great environment, learned a lot, but I felt like there were some significant problems at hand that even a company like Siemens couldn't solve, and probably some smaller companies could address it. And went through taking care of family members who had chronic illnesses, and their care just seemed so disjointed. And I thought, oh, there's got to be a better way. And so actually it was about a year and a half before I left Siemens, I started looking around saying, what would be the right fit where I could use what I've gained to date and make impact with a company that's tackling some of these problems.
I think that was smart on your part, and I know that there were a lot of listeners out there that may have their first or second career and are, for some reason, they were dissatisfied. I've been there, you've been there, right? Like dissatisfied that you could do more, but you don't know how.
Yeah, or you're stuck some way. And it's not bad. It's just at that point in your life, it's better to make a transition.
Yeah, and I think now you're on the other side of that. You've experienced a lot of personal growth from that. And I mention this because I have seen, one, congratulations to you, because one, female business leader. And I'm going to start there. Like I was actually at Siemens, I was part of the Women's Information Network there. And that I joined out of trying to understand a lot of my fellow team members of there's a different lens that a man goes through in business than a woman. And some of that we need to do better, I'll be honest. Compensation, the amount of access to mentors and sponsors, it's different.
Yeah, I always I still do. I mentor a number of people, and my door is always open.
See, that's awesome.
Especially for, I especially like when people, when you get that itchy feeling like, there's something more, I'm sure that I can use my talents to do more. Those people making transitions, that's like my favorite thing to have along.
But not everybody's bold like you to do it though, right? And I also will say that not all that leave, let's say the corporate institution with their processes and budgets and structures succeed in the entrepreneurship world, and you're doing great. So
I think it takes when you've been through a lot of change, you just have to have confidence that even if you get slapped down, you can just get up and learn something new, or something I always say is like if you're a lion and you're hunting, and once in a while someone else steals your antelope, but you can get another antelope. You're just not worried about it because you just get up and keep going.
Yeah, no, it's admirable. I think, but kudos to you, my friend. Yeah. Kudos to you. So let's, one thing I'd like to talk a little bit about is how you got started too. You guys actually, for many startups, some, like with my company, 364, my wife and I bootstrapped it, which is kind of risky, right? Like, I'm definitely risk averse. I'm a risk taker, right? I'm definitely not risk averse. But for you guys also, there was some accelerators that you use, and a pretty big one is Creative Destruction Labs, right? Like CDL.
Yes.
Maybe we could talk a little bit about that.
Absolutely, yes. So Creative Destruction Labs started out of the Rotman School of Business at the University of Toronto. And back in 2016, when we first were getting off the ground, we were essentially applied to CDL, and we were able to we were accepted. And how CDL works, it's very interesting. Basically, it's a I think about an 8-month program where you are constantly meeting and being presented to investors, groups of investors, and you are presenting your plans, and they're giving you assignments. And it's this continual process over 8 months where they're watching how you do things, and they're providing advice. And I think it gives them a good snapshot of what would it be like to be an investor in this company, what would it be like to work with and mentor these people. So we were and people can get voted out as well, right?
Yeah. It's not everybody's a winner.
Not everyone's a winner. So we made it through that program and opened up our seed round following that. And so certainly being part of the Creative Destruction Labs has given us a lot of access, not only for raising capital.
But was that the first pitch you had to do in front of like investors, or?
So, going back to starting stories, at that moment I was not the CEO going through that. So I didn't have to do any pitches in front of investors. That was our previous CEO. But before that...
You got to watch.
Yes.
Kind of.
Yeah, before that we had done a friends and family round financing. So we had done, but that's the friends and family and angels. So certainly we had our pitch, but it's very different when you start talking to angels who are now anticipating, of course, how are you going to be prepared for talking with VCs down the road and getting you prepared for how you can make that story and,
Because their investment now is tied to the success of the company. Right?
Absolutely. And what's great about it is you get a wide kind of variety of companies in terms of the stage they're at as well. So you have some that haven't even formed a corporation, a couple professors out of university, they have a cool idea. Yep. And they're there. And so, if helping you find a CEO or find the right people or just helping you get your business off the ground in the right way, hugely valuable. And so CDL has since expanded from Toronto to, I can't even keep track of where they are now. They're running it everywhere.
And in Europe and
the
UK as well.
And so, it's a fantastic program. And really, I think, given that you don't have to give up any equity to be part of it or pay anything, you're just in the program, and they're really, it's just an incredible source of support and mentorship.
Yeah, so many of the listeners, this obviously is appealing, right? So CDL is an accelerator, and there's a lot of them around that, as they mentioned, it's a program that can help you, really, if anything, kind of, you will pitch, but they'll help you build your business model, help you scale. They have networks and affiliations, and obviously it helps with fundraising big time. Is there any learnings or tips and tricks of, I guess for lack of a better word, the art of the pitch that you learned from this CDL experience? Maybe bad habit you had that you stomped out because of the process?
Or from life and trial by fire.
Yeah, yeah, certainly. I mean, it's an interesting thing. Sometimes you hear the same thing over and over again, and it's not until, the 10th time in front of someone that you realize, now I understand what they were saying. So certainly what we learned at CDL, again, I was not the one doing the pitching at the time, so I kind of learned by osmosis.
But you do it now.
I do it now all the time. So from beyond CDL.
That's why I said trial by fire. You can
absolutely,
the learnings from that we've gained. Yeah.
I mean, so I'm a technology guy. I started as the chief technology officer of Cohesic, right? And then James, my co-founder, he's a clinician. He also comes up with a lot of the design for the software. And so when we started pitching, it was always about the features and the software and the product. And then we're also both academics. And so it would be like, here's all of the background you need to know, and then into the product, right? So by the time we would talk about the business, you'd be like, oh, and by the way, we have a business, and you should probably give us money.
Sure.
So,
And many entrepreneurs are guilty of falling in love with their widget, right? Like, come on, guys, let's be honest.
Yeah, and you hear it over and over, oh, you should talk more about the business, and you go, okay, so I'll add 30 more seconds, another minute, and then you realize, no, it's like this much product, this much business, right? And I think that's just something you learn over time, and then I always re-emphasize probably the biggest factor for success are the people you surround yourself with, right? So making sure you're getting that honest feedback, getting people who have experience doing this to stop you from kind of wasting those resources towards something that you can easily identify up front that this is not the right way to do things and we should do it a different way. I think having that kind of community around you or network around you, I think is incredibly valuable.
And we've been lucky. A lot of the investors I just came 3 years ago, but a lot of the investors that were in the seed round and others some have formed their own funds and bring other resources to bear, and they're always willing to help. And those
you kept a long-term relationship.
Oh yeah, because they're like trusted advisors. They want to see us succeed, and and it's like a safe place to get advice. Like, this is how we're thinking of portraying it now. it's quite helpful.
Yeah. So, CEO, COO, raising funds, accelerators, it's also stressful.
No, come on.
That's, it's, you're right. I mean, I would say, definitely any of you out there, if you're going to start something, fundraise every day of your life. Like, it just is what it is. You need to be aware of what resources, non-dilutive, dilutive, whether they take your equity or not, you need to know your options, right? But how do you guys keep this very positive, pleasant temperament? I mean, I get worked up, but I don't ever see you guys worked up. So how do you, I mean, is there some, hobbies, or how do you stress relieve yourselves?
Yeah, I mean, beyond the late night Manhattan, which will typically cause me to. Then you'll see me. So then you'll see me.
Jordan gets pretty philosophical with Manhattans, yeah.
But on more the everyday sort of aspect, you definitely have to find ways to keep yourself sane, because I mean, when you're starting a company, it is everything. You live and breathe that company, right?
Yeah.
And so one, you kind of have to enjoy both that process, and also what you're doing, right? Or else it just becomes a slog. And so you really have to enjoy that. But not every day can you have that sort of emotional and keep that emotional high. So for myself, I enjoy playing music and doing, writing music.
What do you play?
I play the bass as my main instruments, but I play electric guitar as well when no one's watching. So I find that it's a very different creative activity that has nothing to do with what I'm doing in business. And I find it's kind of a place where I can get recharged. And even listening to music as well just provides that. And then video games, but that's...
I know you're a sci-fi fan. Like, me and him vibe like that.
Yeah. So my wife and I actually...
Battlestar Galactica is still number one?
For me, The Expanse right now is probably number one.
Number one?
I would probably The Expanse number one. Me and Battlestar Galactica have I kind of love-hate there, but...
We geeked out for you there. Yeah. So then yourself. So how do you, keep positive, stay positive?
Well, I'm not always.
That is also something we have to admit. We're not always this Canadian cheerful and positive.
Yeah, I think, part of it at work...
Maybe corporate helps you with that.
Well, in a way, I think because for the work side, you can't expect everything to go well at once, so you have to diversify, and you have to actually, I've learned this from all those other experiences, you have to pick some projects that are sure wins to keep your sanity, while all the other stuff may or may not work out, and so that you can have a little win, and then this one may work or may not work, but whatever, it's all good.
It's pretty smart.
And then
you'll feel like there's progress.
There's progress, and then because we're all perfectionists and we want to succeed, and so it gives you more, flexibility. If something else fails, you're like, yeah, but look at all the good we did. And then outside of work, I like to distract myself by other things that need me. So I've got a bunch of critters that need me, and I love them because they're just in the moment, and they never get stressed by anything.
Always glad to see you.
They're always glad to see me. Yeah. Sometimes annoying, but but they're great. To grow things, listen to music.
You've traveled a lot too.
Fix my German, French. I work on languages. Yeah.
Favorite vacation destination?
Vacation. What's vacation?
Yeah, you got to do it.
Think to the before times.
Oh, the before times. Yeah.
That's in this case before startup times.
Oh yeah. No, I have and I lived in Germany, France, and the UK, so I have a lot of friends there, and I do like to go visit my friends and hang out. So between all that, I stay mostly sane.
That's awesome. No, I think learning, personally sharing, learning to manage the fatigue of entrepreneurism is the name of the game. Like, it is an endurance test. More so than I appreciated before doing it. I'd say it's kind of more like that. Like, yes, I had heard about the gauntlet that it could be. I've definitely, there's kind of like a saying, I guess it's like, if you know, a year in a startup is like 5 years in big business. From the emotional roller coaster of just being on all the time, and like things will break. You just have to get in there and fix it. But I still can say that fatigue, because your investors want you to not look fatigued, right?
There's definitely expectations, that come, and I think it helps to be introspective and realize, okay, am I following these expectations because they're actual expectations, or am I just kind of inferring this because of what I've seen or because a comment someone said, right? And it's something I've learned over the years is there's no real, should in business, like you should do this and you have to do it this way, because especially when we're talking startups, because we're all doing something innovative, and by definition, it's not going to fit the same mold as everything else. And so you have to figure out what things are the, not rules, but that provide benefit to you, and which ones are actually counterproductive. And you need to be able to say, no, I'm going to do things a little differently because I think this is a better bet. And I think that can help alleviate some of those expectations and some of that kind of viewing yourself of, you have investors, but you're still able to make your own judgments and you're still able to make your own calls. And that sort of agency, I think you need to be able to also maintain sanity while, and to your point about the fatigue, certainly, I mean, you're always on and everything, but there's an emotional capital that you have. And I think I'm stealing that from an article I read recently, but I liked it. So the idea of, you only have a certain amount of emotional capital you can put in as well. And that, so.
You two have worked with me a lot. I have a lot of emotional capital to put into things.
But talking about that emotional roller coaster, you have to make sure that you are taking the time to celebrate the wins, recharge, recognize that, yes, things don't always work out, but you have other opportunities, and just make sure that you're not kind of putting all that emotional capital into one particular thing that has to happen, versus recognizing that what you want is really just the success of the business, right? So.
Yeah, maybe I should mention my favorite metric, which is the fun to non-fun ratio. So like for me, if I'm 70-30 or above, like I can put up with 30 non-fun, like just have to get stuff done or whatever, or people,
but you're still majority
or
fun.
People that are annoying or whatever. But if it's 70%, I want to jump out of bed and get going on something.
I like that.
Then that's a decent ratio. And I found over my career, like if it gets down to like 50-50, you're in the danger zone.
Yeah.
And once in a while, if you're 90-10, awesome. Ride.
Good for you. I think that's a great suggestion that you all should think of. Again, glass more than half full.
Yeah.
Right? Pun intended.
It's good to assess where you are.
Sure.
And then do whatever you can to change the ratio. So
what does success for Cohesic personally mean to you two? What is it? Yeah, like, assume, I think you guys are going to do okay. But for you personally, when do you know you've succeeded?
There's a few different dimensions to success. Certainly, if I look at Cohesic as a pure enterprise or a pure business, there's certainly the goal of exit acquisition. It's successful, and we showed that yes, the solution does work in the real world. For me personally, again, I come from a neuroscience background, data science. I'm fascinated by the process of decision making and how we make decisions. So for me personally, if what we see is, we can demonstrate that we have made an impact in patient outcomes and in their lives, and we've done it by improving those clinical decisions, then I go, okay, we figured something out. And for me, that discovery, that kind of affirmation saying, yes, we were at the very least pointed in the right direction and on the right path, and now it's, we've discovered something interesting and can push on it and make more impact. For me, that's where I go, okay, this is a success. No matter what, we know that this is a better way of doing it, and we can improve things. So that's my definition.
Yeah, I think I'm pretty much the same with that. I've been blessed through many years to be involved in lots of different technology development that I know helped patients, but in some ways it was more along, traditional lines, and this way of looking at things is like a different way to impact patient care. Mm-hmm. And like Jordan said, if we're able to actually prove that and help a class of patients live longer with less pain or whatever, that'll be enough for me.
Mm-hmm. Good for you, because you're very humble too, because you've won an award recently. I saw this. What award was that?
Yeah.
I was just named to the AIMBE College of Fellows, which is an organization for people who have done things in biological and medical engineering. And the organization is geared not, to spread the word, but also to pay back to the community. So either through lobbying the government or helping in policy design that helps advance the field. So I was just inducted, so I look forward to working with that group.
And you were inducted for many reasons, but a lot around your work of how to translate innovations from research environments into a commercial environment, which is what you did at Siemens and before, and then now what you're doing now as well. So it really was for the work that you're doing. So, which is, I think an amazing recognition.
Thanks.
So for some of my audience, some of them are medical practitioners, or they are, so many degrees separated from a medical practitioner. How can they learn more about decision intelligence? I'm assuming there's, on the research area, you guys do things, website, like how can they find out more information about Cohesic?
Of course, our website, cohesic.com, can find information there. We're also working with great marketing companies that produce some prolific social posts. So
might they be?
Yeah. So if I think in particular, I would encourage people to follow our social channels on Twitter, LinkedIn, Instagram, Facebook, all the places. Mainly, because what we focus on is educational content a lot around these issues in healthcare. How can we improve decisions? What are we learning? Right now, Cohesic is focused on cardiovascular care, so that's a lot of the content that we are focusing on, but also general information about how to bring AI into clinical practice. And I think, or certainly hope that it's a resource people can use beyond learning about Cohesic as well.
Yeah, and maybe I'll give a shout out to a book about decision intelligence called Link by Lorian Pratt.
Yes.
That, it's a nice read and helps people understand, what's the difference between decision intelligence and all these other fields that are related to it.
Okay, well, fantastic. Well, I appreciate my guests coming, and I appreciate my listeners. This is a business that is out to make our lives better. And for many of us that could be afflicted with cardiovascular disease, and even other diseases, I think we all agree that getting the most relevant facts and data to our healthcare practitioners help them make better decisions, which indirectly makes our lives better. And that's the name of the game. That's what we're all trying to do here. So I hope you enjoyed this great episode. And please take a look at Cohesic. It's a great company. And, best of wishes to all of you. And I hope you find more inspiration for you to step out and to start a company to make the world a better place. Take care.
Twist of Fate is hosted by Doug Younger. It's produced by John Lundvid and Matthew Brown at EZO Creative. Moni Yu designs our graphics, and Enrique Pimentel manages our digital life. Our theme music is by Jamie Bathgate. Special thanks to all of our patrons. You can support the show by visiting patreon.com/twistoffate podcast. Thanks for listening.